Atlas and axis of P. A technique of P anterior-posterior open mouth. In this view, we will be demonstrating an apiaxial view of cervical spine. The apiaxial should be performed with the patient standing at the upright back knee or laying on the table. So, the patient position is upright or supine or laying on the table, and the part position is center MSP, median sagittal plane, to midline of the table, arms at size, shoulders on the same plane. Center eye are at level of axis, open mouth wide, obviously, and if the patient close his mouth, so, teeth. His teeth and skull will be prevent and be in front of the axis and atlas. We're not going to take the image properly, shield gonads, and the patient should pronounce or during the exposure. Central ray is perpendicular to center of IR, entering open mouth. Collimation is adjusted to 5 × 5 inches. Place a marker in the collimated exposure field, and the required voltage for taking this exposure is 85 kV.